Tuberculosis, or TB, remains a major global health challenge. It affects millions and claims numerous lives each year. Early diagnosis is critical to curbing its spread and impact. Prompt identification allows for timely treatment, preventing further transmission. It also reduces the risk of complications and improves individual outcomes. Delayed diagnosis can have devastating consequences. It increases the likelihood of transmission to others. Patients may experience worsening symptoms and disease progression. This delay highlights the urgent need for effective diagnostic strategies. Healthcare professionals must remain vigilant in identifying potential cases. Clinical suspicion is paramount in the diagnostic process. Healthcare providers should consider TB in individuals presenting with suggestive symptoms. These may include a persistent cough, often productive, lasting for more than 2 weeks. Other symptoms include fever, night sweats, weight loss, and fatigue. A detailed medical history should be obtained. This includes travel history, contact with TB-infected individuals, and prior TB treatment. Physical examination should focus on respiratory and systemic signs. Any suspicion warrants further investigation for TB. Chest radiography is a cornerstone in TB evaluation. It aids in visualizing abnormalities suggestive of TB. These may include infiltrates, cavities, or nodules, typically in the upper lobes of the lungs. However, radiographic findings are not always specific for TB. Computed tomography, or CT, scans offer a more detailed assessment. They are particularly helpful in identifying subtle lesions or complex disease. CT scans can differentiate between active and inactive TB. This distinction is crucial for guiding treatment decisions. Section 4. The gold standard, sputum smear, microscopy, and culture. Microbiological confirmation of TB is essential. Sputum smear microscopy remains a cornerstone of diagnosis. It involves examining stained sputum samples under a microscope for the presence of acid-fast bacilli, or AFB. This method is rapid and cost-effective. However, microscopy has limitations in sensitivity. Sputum culture is considered the gold standard for TB diagnosis. It involves growing TB bacteria from sputum samples on specialized media. Culture confirms the diagnosis and allows for drug susceptibility testing. Section 5. The future is now. Rapid molecular diagnostics for TB. Nucleic acid amplification tests, or NATs, have revolutionized TB diagnosis. These tests detect TB DNA or RNA in clinical samples, providing rapid and accurate results. NATs offer improved sensitivity compared to smear microscopy. They are also faster than traditional culture methods. NATs are particularly valuable in resource-limited settings. They facilitate prompt diagnosis and treatment initiation. This is especially important in high-burden areas where access to sophisticated laboratory infrastructure may be limited.